It is 11:04. Dr. Payne, 1-855-55-DRLOU. Dr. Payne, DRLOU is the number to reach out when, outside the radio station, info@paincarecanada.com. But you have an hour to call in here and
call in, yes.
Whine, bitch, and complain. Whatever. You got problems, physical issues, pains.
I got to admit, I'm jealous that Premier Ford never calls me.
Oh, maybe he will now.
Yeah,
because
I'm very
totally
conservative on
health.
Well, yeah, and I would say I'm more of a conservative, anyways. But yeah, I think there's a lot of waste that goes on in the healthcare system, and there needs to be things that change because we're going to go bankrupt one day, and people are not getting the quality care that they need, although they think they are. You know, I had somebody the other day. Oh, it's actually my niece. She has a referral to an ENT. She's 6 years old. She's been having a chronic ear infection. Finally, family doctor said, you know what, let's refer this. I'm going to put it in as an urgent referral. Do you know when her appointment is?
2019.
No, middle of June. Like,
wow,
that is not urgent. Like, you know what I mean? That's like, oh, okay, well, don't worry about it. Go somewhere in June. That's, and it's just funny that that's the urgent referral. And so, I think there's a lot of waste that goes on, and there's definitely a better way to manage the system, which is why we do what we do.
Yeah,
but that's neither here nor there.
Yeah.
You're just staring at me.
No, I know because I've been through that time where it's like, when's my MRI? Really?
Yeah, really? Sometimes it's crazy. It could be a year, and it could take a year. You know, things like sometimes hip and knee replacements are taking more than a year for people to get. It's insane the wait times and just the waste. And I'm not suggesting that we should be a fully private system or anything like that. But definitely there's a lot of waste that happens, even simple things like people who abuse emergency rooms or walk-in clinics and are going there for
headaches. Simple, basic things.
And they know their problem. It's one thing if it's a new headache. Yeah. Right. But what about the people that are going there every time that they get their same headache that they get every other day, and they're in there and just using those taxpayer dollars,
or just to get us a prescription?
Just a quick prescription. Yeah, exactly. There's so many things, but anyhow, so let's one of the things that we often talk about here is spine related pain, and I guess a lot of the listeners have heard me talk about how 90 to 95% of cases are what we call mechanical issues. Okay. Which is the reality of what I see. And a lot of people come in and they've heard me say this, and people tend to be afraid that they have the 5%, right? Like that's what people really want to know. I think that's what drives people, is that they want to make sure that they're not the serious stuff. And it's like, oh, okay, if it's just mechanical, okay, no problem. And so I've had a lot of people come to see me saying like, I have this issue and I'm just wondering, do I fall within that 95% of cases, or am I 5% that I need to worry here? And then, I'll examine them and I'll say, this definitely seems like it's 95%. Okay, good. So I don't have to do anything. And it's like, well, no, that's the wrong answer, because the 95% of cases of mechanical spine pain is what creates the disability. This doesn't mean that, although it's mechanical, doesn't mean that it's not disabling, that it doesn't create pain. These things can be very disabling. They can create a lot of pain, and they can ruin people's lives. And if you don't intervene quickly, this is where the mistakes happen. And I had a few people this week and I hear it all the time. Oh, I've been listening to you for such a long time, and I finally decided to come in with my issue. Stop waiting. If you're listening and you have an issue, just come in. Come get it taken care of, because the intervention when you get it early is so much simpler. The treatment time might be much, much less. You have a better chance of full recovery or close to full recovery. You have a better chance of minimizing reoccurrences and all these things. So people that are sitting there and they're listening and they're like, yeah, I should make a point to go see Dr. Lou. Stop putting it off. You need to come in sooner rather than later. Now, that doesn't mean that there's a point that it's too late. It's just the big thing that I want to get across with this show is that getting in early is always better. And you just, it improves so many things about your prognosis when you can get in early checks. Sometimes I see people and I just give them exercises to do on their own at home. They don't have to do any formal treatment, anything like that. And they're good. And we've had multiple people that have called the show and said that, like, oh, I went to see Dr. Lou, he gave me some exercises to do. I did them. I've never had the issue.
My sister-in-law.
Yeah,
still
exactly.
Rocking and rolling.
Yeah. And she was subacute. She wasn't at a chronic point, but she did intervene from an acute standpoint because she didn't call me right away. We sent her for treatment, but that's the right protocol. That's the right way to do it. And that's why she's managing well. But there's been other people, and I've had tons of calls of people that have followed up to tell me how they're doing. And I always appreciate that, hearing about people that have seen me and following up. I do suggest to people to follow up within 6 months, usually depending on what they're going through. Some people don't, but I'm always interested to know, how someone's doing. I'm also interested to know, I to this day, I haven't heard anything negative, but if there is ever anything negative about the experience that you have with me or my team, I would love to know that, because that's the only way that we can make change. If we don't know that there's something potentially wrong, then we can't really make the change. So if I know those things, then I can definitely work towards changing them, because I know we're not perfect. But like I said, to this point, we haven't really heard anything. Any negative feedback, which is good. But I also think that that's because maybe people are hesitant to give negative feedback. But as long as it's constructive and respectful, I wouldn't mind hearing it. I would actually appreciate it. And I've always been like that, even through schooling with professors and things like that. I want that constructive, respectful feedback. It's very, very important to ensuring quality.
It always makes you scratch your head with the, I've been listening for a year, then finally I decide to do something where, if their Wi-Fi is down for 10 minutes, they're on the phone.
Yeah, it's human nature, I guess. I mean, people do delay it. I think I'm guilty of it too for certain health-related things. I'm sure you are as well. But this is why I do what I do, just hammering it back in. Like if you're dealing with it, it's another week that you're listening. Stop just listening, give me a call, and let's get you assessed, and let's get it figured out and put you on the road to recovery.
And you have questions immediately. Feel free to call in, get some perspective. Anyway, 416-870-6400 star 640 on your cell. Dr. Payne Show right here on Global News Radio 640 Toronto. It is 11:15. Dr. Payne Show, 416-870-6400 star 640 on cell. We talk about keeping busy, keeping moving. Movement is life. There's a perfect example playing Springsteen. Guy, 68 years old, still does 4-hour shows. You know why he does that? Because he keeps himself in phenomenal shape.
Well, even I remember once Hulk Hogan, someone asked him once, like, why he still works out at his age, and he essentially said, if I don't, I wouldn't be able to move. Right? And I've seen a bunch of elderly people who come in and they don't want to stop. Like, they're like, I don't want to stop. And it's like, no, you shouldn't. No. Like, at a certain point, it's almost that boundary of you have to work through it a little. Like, you have to accept a certain amount of pain, because there's this misconception that people believe not doing anything makes your pain go away. But I've seen it a lot with car accident patients, where they essentially stay home and they do nothing, and they get worse and worse, and they're wondering, well, I'm resting, why am I getting worse and worse? It's like, well, bed rest is going to make you worse. Our bodies are not designed for bed rest, and never mind just the physical aspect of it, but how would you feel from a psychological perspective if you're just laying at home in bed all day? Like, you can't possibly feel psychologically good about that. And so it compounds, and it's like you see these people, and then they're like, yeah, but I want to do something, but I'm in so much pain. It's like, yeah, but you have to break through a certain level. Like, you have to force yourself. It's the same thing as when people say, well, I can't work out because I work out and it hurts. It's like, well, there is some amount of hurt that's going to happen, but is it harmful? No. And that's a big component in treatment, where we talk about hurt versus harm. So there are certain things that, yes, are going to hurt you, but they're not harmful to your recovery. But then there's things that may not hurt you at all, but are incredibly harmful. So people think, well, me sitting there doesn't necessarily hurt me, but you're doing an incredible amount of harm to yourself physically and psychologically by just thinking that sitting at home is the answer. It is not the answer. It's never the answer. The other problem with it is there's a secondary gain component, right? When there's money being involved through litigation and things like that, and people feel they have to, put on a show, for example. Like, if someone's watching me, I got to show that I can't do anything. Yeah. That secondary gain ruins a lot of prognosis and recovery. And the reality is that these people actually end up having pain because it's psychologically created, because that's what happens. And so I've seen this, far too many times that I like to remember, in all honesty. But people that are in these types of accidents, really, they need to do themselves a favor, and you need to break through that, because it's the difference between your quality of life. Right. And it's a big thing that a lot of people are short-sighted. They don't realize that. And how many times have you heard me tell somebody, this isn't just about today. We're talking about, well, what's your life going to be like in 15 or 20 years? And people are only ever really thinking about the immediate gratification of something. So, well, the case is going to settle and I'm going to get X amount of dollars. It's like, yeah, but what good is that going to do you in 20 years if you feel like this all the time? You're trading quality for some sum of money. I don't know if that's something that's worth it to you, then fine. But I don't think that's something that should be what anybody considers anyways.
416-870-6400 star 640 on cell. You have an opinion on that. You have pain. You have some questions about your own physical health. Bring them on. That's why we're here every Saturday.
Any injury-related questions, anything like that. Yeah,
we got a guy. I don't know if you remember because he used to go to Fitness 365, our gym on Ronson there in Etobicoke, and there's a guy there named Hans. If he's not 80, he's going to be this year.
Was he the bodybuilder? The guy that was...
No, not Mike.
That's
Mike's
Mike.
A different
that's right.
Yeah. Hans is a very, very nice man. He's bordering on 80. Like I said, if he's not 80 now and he's still in there, man, the guy's benching plates. Anybody who works out knows what that means. It's 135 pounds. He's still doing that every day. That guy's in there lifting weights. He's squatting. He's doing his, he's not setting records, but the guy's almost 80.
That's not the point.
And he's lifting weights, dude. The guy's amazing.
And he's keeping up with probably what he's done for so long, which as you get older, that's a big component about maintaining what your life is like. Because once you start to lose those things, again, this is where the psychological aspect falls into play. You start to lose a sense of purpose, right?
Something else I can't do.
Just another thing. Like now, my kids don't need me anymore. I don't have a mortgage to pay, so I don't have to work. And now I can't even work at a certain point psychologically, it's like, well, what's the point? Even though I can't wait to not have to pay a mortgage anymore.
Right, no kidding. But losing your driver's license, losing your independence, stuff like that.
All that stuff. It's crazy that as that progresses, the more and more things that you take off the list, that hurts towards sense of purpose. That's why a lot of these older people, like I've heard countless stories, especially being of Italian descent, a lot of my parents' friends, that just workhorses, people that work their whole life, they retire, they stop working, a year later dead. And to me, there has to be something there, like a sense of purpose. I really do believe that it's important to feel like there's a point to your life, because if there's no point, then I guess that's what happens.
Can't wait to retire.
Yeah. I think our generation is different. Our generation is different. Yeah, exactly.
Yeah. You got to keep moving. And if you want to give us a call, we'd love to talk to you. 416-870-6400 star 640 on cell. You have physical issues, some pain, want to start getting some answers, call Dr. Payne right here till 12 o'clock. Global News Radio 640 Toronto. It is 11:23 on Saturday morning. 416-870-6400 star 640 on cell to reach Dr. Payne here this morning. Want to ask some questions about your own health? That'd be great.
The radio show is the same. Like we always get in the last 15 minutes.
40 calls.
Yeah. And it's like, it's the same thing that we're talking about, that they're listening, they have pain, and they're, call in now. Now, there's still plenty of time. Yeah. And then that way I don't have to rush each call.
You can have a lengthy chat.
Yeah, we can have a nice talk about your issue. It's a nice way to do it, I think.
Pinpoint Health is what it's becoming, right?
Yes. So, and you know what? In May, we're going to rebrand everything about the radio show as well. It'll be the Pinpoint Health Show, and just keep a consistent brand. That way, again, people can feel safe when they see that name and they want to go in. And here's a big thing. You don't have to see me to feel safe. And that's really what I want to create, is that they understand that the brand is associated with me, and that I control the brand. And that means I make sure that, I had a person this week that I saw in Brampton. They live in Toronto. They needed some treatment. I suggested our Etobicoke office. They said, perfect. That's a great location for us. And they said, we want to see you. And I said, well, I don't do the treatment, but I'll refer you to somebody who does. And they were sort of like, no. Like, we love what you have to say, and I really want my mom to see you. And I said, you can rest certain that if someone is part of my team, I've done that because not only do I think they are as good, but I likely believe they are better. Mm-hmm. I make sure that it's the best people, the best quality that we have. And in fact, that goes for if you're a healthcare professional or you own some type of clinic and you're looking to be affiliated with a brand or partner with a brand, or you want to work with the brand, give me a call. I'm happy to talk to those people. We're always looking for ways to expand. Yep. And I think and you know what? I'm actually going to make a point to speak about that more. But anybody that owns any type of clinic, if you're a healthcare professional, you're looking to, you've heard me before, you like what you hear, you want to affiliate, you want to somehow work in a symbiotic relationship, I'm happy to do so. I'm happy. Yep. My biggest thing is how can we make sure that we send people to good quality places? And as you know, through our provider network, these are not places that we own and control, but they are people and practitioners that I trust. And I wouldn't make a referral to someone if I didn't personally. In fact, I've had people that have said, like we had a few weeks ago, someone that reached out from Winnipeg, I believe it was.
Yep.
And they said, I'm looking for someone there. And I said, listen, at this point, just you do your own research, because I don't know anybody in Winnipeg, and I don't feel comfortable saying go to this clinic because I don't know them personally. And this isn't like, I can look on a website and look for some red flags and things like that, but I don't know for sure, and I don't want to hang my hat on just, oh, well, this looks like it's a good, reputable place. No, go. The best thing at that point, if I don't know, is I usually say, well, read the reviews, number one, because Google reviews do provide insight into the place. And then the other thing with healthcare professionals is just check out their whatever their regulatory body is, and make sure that they don't have anything, that they're in good standing.
Right.
Those are all very important things to look for. And then you just sort of have to go based on trying it out. And here's the other thing. If you start somewhere and it seems good, and then you're in 1, 2, 3 treatments and something doesn't seem right, don't continue.
Yeah.
People always
trust
do
your
that.
spidey sense.
Yeah, exactly. If there's red flags, then get out of there. And some red flags, to look for is it only one thing that they're selling?
Right.
Like, is it just this one thing solves every single problem known to humanity?
This machine.
Yeah, or whatever, or this protocol or whatever. I'm not suggesting that doesn't work for certain things. I'm just suggesting if it's a one fix for everything, that to me is a problem. If they're saying, hey, this one thing is really good for A, B, C, and D, these 4 or 5 things, it's like, okay, then maybe that makes sense. But I've seen way too many machines or protocols where it's like, no, this is actually good for anything that you have. Here's what you need, and it will fix anything. If the treatment plan doesn't make sense to you, like if you have something going on and someone's suggesting that you need to go for, 40 times over the next year, like it needs the extent of the injury has to coincide with what the treatment protocol is. If there's anything fraudulent going on, a lot of, like when we're talking about manual therapy and physical therapy, a lot of this stuff is through health insurance companies,
and they've directed you to a certain place.
Possibly. Yeah, and if there's fraudulent things going on, or if they're saying something to you like, we'll bill this, but you'll actually get this. That people need to understand something. That does not just fall on the clinic. If you do something that's fraudulent, it is both the clinic and the person who is the insurance holder. So if you are letting a clinic do something where they're billing something for you and you're using it for another service and you're aware of that, you're just as guilty as the clinic is.
Right.
And so the insurance companies can come after you as well. So that's a big thing, I think, to be concerned of. What else are some red flags that I always tell people? I don't have a list, but those are definitely some of the big ones that I would look for. But a lot of this just comes down to gut instinct. A lot of people are like, man, didn't feel right from the beginning.
Don't smell right? Well, it probably isn't.
Versus if you go somewhere, it's like, no, I really liked what they had to say. It all makes perfect sense to me. They did a good job explaining it. The other thing is if you ask a question and they don't want to give you an answer, right? Like that would be a big thing, which seems counterintuitive, but I've heard it a lot where people are just told, no, like you need to trust this. And if you don't trust it, then this isn't going to work. Well, no. What's a logical? What's the logical answer here? There's got to be some process that happens.
We got time, and we have phone lines that are open, so now would be the time. 416-870-6400, star 640 on cell. You want to reach out to Dr. Payne outside the show, info@paincarecanada.com for now, and 1-855-55-Dr. Lou, DRLOU. We'll continue after a short break on Global News Radio, 640 Toronto. 1031 Dr. Payne Show. To call in, 416-870-6400, star 640 on your cell. Randy, good morning. How is Bob Cajun?
It's warm today.
Love the Bob. Love the Bob. What's going on, pal?
Well, I was in a car accident in 2015, and I had serious multiple injuries. And, like, I still have some issues, but, like, my lower back and neck stiffness, it won't go away. I've been going to physiotherapy for next week will be 3 years now, and it just doesn't seem to be helping anymore.
What are you doing at physiotherapy?
He works on different parts of my body, from my arm and knees to back and neck.
Are you doing exercises at home on your own?
I actually have a personal trainer.
Okay,
And I have to stretch. And
so how often is this personal trainer doing stuff with you?
she's with me once a week, and I see her the odd time there at the gym.
Okay, but you're doing stuff every day on your own, regardless of being with that trainer?
Twice a day, so a lot of times, yeah.
Okay, good. And then the issue is that you're just so here's an important question. From the point of the accident or immediately after to now, would you say you're better, worse, or the same?
Well, I'm better now because
Yeah.
I could hardly work and bend and
Right. So and this is a lot of injury stuff is also about realistic expectations. And
Right.
sometimes you reach a ceiling of improvement, but you just said it yourself, you're much better. Are you perfect? No. Are you ever going to be perfect? Maybe not. And really what you're doing is really about maintaining you where you are now so that you don't get worse. So sometimes that's really the expectation. It's like, you were horrible and now you're much better, but still not perfect. But you want to stay at that and not go back to horrible.
Right.
And so that you have to keep up with everything that you're doing. And a lot of people feel discouraged. And this goes back to what I was saying to John about the short-sightedness of things, where it's like, well, it's not helping now. And it's like, yeah, but at this point, it's not really about now anymore. It's about you in 10 years from now. It's like, how does it keep you moving? How does it keep you where you're at for a longer period of time? So it sounds like you did the right things, which is good. And it sounds like you continue to do the right things. I think a lot of injury stuff, especially related to high impact trauma like motor vehicle accidents, is about a realistic expectation. Like what is the reality of improvement? And it sounds like maybe you've achieved what the reality of improvement is, and it's about maintaining that.
Yep.
Mm-hmm.
Okay.
All right.
Okay.
I'll keep at it.
Yeah. Good.
Thanks, Len. But I mean, that's exactly what it's all about, right?
And I know it seems sort of like, oh, I was really hoping for a different answer, but if I had a magic cure or something, I would be a gazillionaire. So I don't have that, because the reality is the best around this management, around pain and injury, is the management of it sometimes. Sometimes it's just the realistic expectation. It'd be no different than if you got diagnosed with diabetes and then all of a sudden, okay, you're put on medication, you change your lifestyle, and it's like, yeah, your blood sugar is overall well controlled. It's not perfect like it was when you were 20,
Sure,
but it's well controlled so that way, whatever eventual consequence of diabetes doesn't happen in 2 or 3 years, but maybe happens in 22 or 30 years.
Yeah.
And pain management is sort of the same thing, unfortunately, where depending on what the injury is, sometimes there's a ceiling of improvement that is realistic.
416-870-6400 star 640 on cell is the way to call in just like that. Hi, Len. Thanks for hanging on. Good morning.
Good morning to you, John.
What's happening?
Yeah, I just wanted to know why is it that I feel as if I don't have enough energy when I want to go, go for a walk. Even when I want to go for a walk, I go. And, after a period of time, I start feeling sort of my muscles giving way, sort of, and, and I'm trying to figure this out, why this is happening.
How old are you, Len?
I'm about 80, I would say. Yeah, 80.
So are you asking me over the phone what you think? You want me to just give you a diagnosis, like what the reason is, or do you have a question?
No, I have a question.
Yep.
I'm sure you may have an answer or possibilities. That could be taking place. I mean,
energy. There's like that is such a broad thing that there's. I can think even just quickly off the top of my head, like no word of a lie, like 100 different things. So it would be impossible for me to tell you based on that one sentence, what I think is wrong with you. There's so many things that would need to be considered, so many other things that would need to be ruled out and ruled in. And that's what the whole point of an assessment is. So I think you're a good candidate to see me, and then we can discuss everything that's going on, and we can sort of, start to cross things off the list, because low energy can be due to so many different things. Like I'm thinking of like 100 different things that I could just start rhyming off right now.
Okay, I mean, I understand what you're saying, but this is something I didn't feel before. It's just happened fairly recently.
Mm-hmm.
I mean, I'm on certain drugs, cholesterol drugs and things like that, and only recently I started taking water pills.
Mm-hmm.
And I was just curious if that could be an after effect, because as I said earlier, I never felt this way before, so I was just curious.
Yeah. So my answer still stays the same. There's a bunch of different things that could be causing that. Could it be a change in whatever medication, new or old, that you're on? Blah blah blah. Yeah, absolutely. But I don't know. There's so many different things that could cause that. You could have something totally different going on. That's where you need to be investigated. That's the only way to have an answer to that.
Want to get you to reach out, Len. Write this down, 1-855-55-Dr. Lou, DRLOU, 1-855-55-Dr. Lou, or info@paincarecanada.com. Please arrange that and get to it. We'll take a short break. I see you there, Evan. Hang on the line. We'll get to you. And plenty of room for you as well. We got lots of time. 416-870-6400, star 640 on cell. Give us a call and get some questions happening and some answers happening as well. Dr. Payne Show, Global News Radio, 640 Toronto. 11:43.
What a choice, Jody.
I know.
If I seem uninterested, it's because I don't care.
It's the Dr. Payne theme show.
Yeah.
It's the theme music for the Dr. Payne show.
Call on in, but I don't really care. Yeah.
Now, 416-870-6400, star 640 on cell. At least get some answers or some guidance to start with. Evan, good morning. How are you?
Good morning. I'm fine.
Beauty.
How about yourself?
Good. What's happening?
I have actually a long history of neurological problems, and it all stems to me playing semi-professional sports. And it's I did something the other day, but all this stems to when I actually broke my neck about, 15 years ago. I was told it wasn't broken, it was actually shattered. And they had to replace C3, 4, and 5.
Okay.
With a long-term. Now, I'm through that. I'm walking. I wasn't actually supposed to walk, I was told, but I'm walking. And because there is long-term damage, where it slightly crushed my spinal cord, making the left side of my body from the shoulders down completely dead to feeling pain or anything in that nature. Okay. The right-hand side of my body feels everything as it did prior to me crushing my neck.
Right.
Now, as a result of that, balance is obviously an issue.
Yeah.
And through that time of the 15 years, obviously my right leg, especially my right knee, has been burdening most of the weight for balance.
Mm-hmm.
Because I can't feel anything on the left-hand side.
Right.
4 years ago, playing golf, I tore my meniscus.
Mm-hmm.
It healed for the most part, but there was always a slight tenderness. I'm able to manage my pain just by meditating when I have to play a sport, okay? But then it comes back after that. 2 days ago, I played my last hockey game of the season, took a bad fall, and now I re-agitated that left meniscus, but I added what I believe is a torn groin and torn thigh. I went in for ultrasound and x-rays 2 days ago, and I'm waiting for the results. Now, the pain, if I don't manage it through meditation, could be quite, let's just say, excruciating. but I know what I think it may be, but I'm waiting for results to a proper diagnosis of what actually happened.
Okay.
And
What's the question?
The question is, with golf season here, I'm going to be playing golf.
Yep.
And my belief is, should I wear a sleeve, a groin sleeve, belt, a sleeve for my right thigh, and a brace for my knee as I play?
So, okay, let's go back to the knee for a sec. How do you know you had a torn meniscus is my first question.
Because when I went in after I tore my meniscus, actually that happened on the golf course, I went to the hospital and it was definitely diagnosed as torn meniscus.
By who?
By a doctor in Mississauga.
Through imaging or?
Through imaging.
Okay.
In this case, it was a CAT scan because my neck is fused. I can never have an MRI again, so it has to go through CAT scan.
Okay, and then my next question is: you said it healed. How do you know it healed?
I was able to continue my everyday life.
Okay, so symptoms improved is what you really mean?
Symptoms improved. Yeah.
Okay, yeah. So this is an important thing. So sometimes people think something has healed, like a meniscal tear. Now, it also depends what type of tear it was, but sometimes they don't heal. It's just the symptoms improve. And so that's an important thing to consider. So the question about whether you should wear a sleeve around the groin, if you have a groin strain, the best thing you can do is get a little bit of physical treatment on that, and that should clear up right away if it is a groin strain. In terms of a brace for the knee, it really depends what the exact issue in the knee is, and I would need to see you in order to really determine what that is, because there's too many inconsistencies that I'm picking up from the story where it's sort of not painting a clinical picture for me that I can make sense out of.
Okay.
But you definitely have a lot of things going on with your previous injuries. So yeah, I mean, a brace might be something that is worthwhile. But I'd have to see. I'd honestly have to take a look at the function of the knee to see what it's like.
Okay.
Okay?
Okay.
Okay.
So we'll get you to reach out, Evan, if you would. 1-855-55 Dr. Lou, DRLOU. Email as well, info@paincarecanada.com. We'll take a short one, and still a few minutes to go. If you want to call through with your questions, do so. Now would be the time. 416-870-6400, star 640 on your cell. Dr. Payne Show. Global News Radio 640 Toronto. It is 11:52. We had a call. Don't know where it went. Actually, we have three, which is never fails. Never fails.
It's okay. You can call anytime after the show as well, right? Yep. That's the other thing about calling 1-855-55 Dr. Lou, DRLOU, is I'm happy to have a conversation with you and see if I can help you out.
Was watching. I'm not a hardcore watcher, nor do I play. Watching a bit of the Masters.
I'm not a hardcore. Oh.
It's like I look bending and twisting. Ooh,
I know golf.
That's not what we're made for, right?
Not the low back is definitely not designed for a bend and twist.
High fast rotation.
Well, and that's why with the new age golfer, like definitely since Tiger Woods. I mean, the reason why Tiger Woods has sustained so many like devastating low back injuries is because the amount of force and rotation that they do put through their back. Like this isn't like you're watching, someone golf 50 years ago.
Sam Snead back in the day.
Yeah, and it's a smooth swing, and you're not
graceful.
Now these guys are hitting the ball like they're pumping that ball, and that in order to do that, you have to generate a lot of force, which means you have to literally use every muscle and joint to create that force, and that rotation component is not what your low back is designed for. It is not. And it's not even just rotation, but you're slightly bent.
Right.
So it's a bend and a twist, which everybody knows. Don't pick up a box and twist. Like that's what we teach everybody. And it's a pretty dangerous thing. The bend and the twist that can happen. But that's why these guys that's why we've all also seen. Look at these golfers now compared to 40 or 50 years ago. They're athletes. They're in top physical shape.
And that's the thing. Where are these guys going to be? I mean, guys like, Jack Nicholson, Palmer, they could do it for 50 years. I don't think these guys are now.
Well, but these guys, they're in just top physical shape, especially their cores. Like they know what the risk is, so they're building up to be able to compensate for putting that force. And they do maintain well. Like Tiger was I would say the first of that generation. Like you looked at Tiger, he wasn't the typical golfer. Like he was getting big, strong.
And he's not John Daly.
Yeah, and that was not something yeah, exactly. That wasn't something you saw before. And the whole reason around it is because they need to be in top physical shape in order to generate that force over and over and over again through their bodies and not be injured. It's an incredible thing to watch, but I love the Masters. I love when golf season's here.
Do you get a lot of golf and sports injury into your clinic?
Oh,
and
yeah.
Is it the opinion of the athlete saying, man, I don't want to stop what I'm doing?
Yeah.
I don't want to lay down for 2 weeks or 3 weeks or forever and change things.
For sure. And a lot of the times, so more often than not, if we are going to recommend rest, we're recommending rest for a period of time. And for some people, it's like, especially high-end athletes, not so much with golf, like the recreational golfer, but we have had some people that, are golfing at U.S. colleges and stuff, and any top level athlete does not want time off of their sport. That's like a big no-no. But the reality is sometimes you have to make them understand that they're trading that short-term time off in order to be able to continue doing
But
this.
it's often active rest. If that
Oh
makes
yeah,
any
yeah.
sense, right?
It's not like, hey, go home and rest and do
Netflix
nothing.
for 3 weeks and
No.
a bag of chips.
No. It's like rehabilitation.
Right.
It's just maybe you're not competing. Like we had a young dancer who hurt herself, and we recommended rest from her competitions because every weekend she had competition. So I said for 3 weeks, don't be doing anything in terms of competition, but you can still be practicing because that's how you can manage yourself. Like the thing about competition is you go all out versus in practice, you can stop. It's like, no, this is bugging me. I'm going to just call it quits right now. And so it's active rest. Yeah, absolutely. Very rarely do we ever suggest like a complete rest unless it has to do with like a very severe injury or very severe fatigue, like something where you're just drained, you're done. Or there's a very severe injury. But no, active rest is really the way we go about a treatment protocol for sure.
Bodybuilding back in the day was a very trendy thing. It's still around, but not to the way it is now. Now, a lot of it has been replaced, and a lot of, I would even say young kids now are on the MMA train. And there's a lot of, that's pretty hardcore, whether it be jiu-jitsu or Muay Thai. Where do you see that resulting in the next 15 to 20 years as a clinician? Are you already starting to see like, this could get out of control?
No, I think we're so much better at from a diagnostic standpoint at looking at things that I don't think it's really a problem of people doing anything. It's just a matter of people gauging it and understand. Like the biggest thing I think is listening to your body, and that goes whether we're talking about like these types of athletes or someone who's just recreationally working out or doing things. It's about if your body is telling you something, especially if you can isolate, like every time I do this, I feel that. That is your body telling you something. It's the ignoring that is the bad thing. Does that mean you can't do the sport or the activity that you love to do? No, absolutely not. But it's about modifying it so that you could do it for a long time. It also is what's your goal with it, right? Like if your goal is, well, no, this is just something for me that I want to keep active with, well, then there might be modifications you want to make so that you never, put yourself in danger of serious injury. And I guess an example to that, like, is if you really like boxing, are you going to go in, if this is just something you're doing to keep fitness, you're going to wear headgear because you don't need a concussion. If you're doing it just to stay healthy and keep moving, well, why would you do it? Versus if you're actually training to become a professional fighter, well, then you're not going to wear headgear in a fight because that's not what's mandated in the sport. So it's about knowing the reality of what you want to do with that sport.
And would you suggest before somebody, especially young, come see someone like yourself, prior to getting into it, to have a physical check anyway? Say, I would be cautious because of this, and this.
It's not a bad idea, yeah. Right? Yeah, for sure, because you can look for deficiencies in biomechanics. So you can see. Now, there's a dangerous thing there because it's also about like, I could look at somebody and say, well, this is the type of person based on this mechanics of this, and this, knee injury is likely. But you don't necessarily want to be telling people that because you've sort of put it in their head. But you could get checked out, like, and there's a way to properly do it and let somebody know, like, just be careful with this, and this, because, you might be predisposed to this type of injury. the one thing that I will say, going back to the example of MMA, so anything that is some type of involves head contact, if your child is in that, I would definitely get them baseline tests for concussion. That doesn't need to happen when they have a concussion. It should happen before. Baseline testing is prior to any type of injury, so we know where we're getting them back to.
We are back next week at this time. As you know, right after Greg, you get to Dr. Payne's show at 11 a.m. In the meantime, 1-855-55-Dr. Lou, DRLOU, and info@paincarecanada.com. Till next time, Dr. Payne Show, Global News Radio 640, Toronto.